Guys,
Hey, ROMEOs.
how are we?
Very good.
Are you having a good day, Aki?
I'm having a great day when I'm with you guys.
Why are you having a good day?
Because it's a Romeo day and every day is Romeo Day.
He's become a solo artist.
There you go.
You gotta love it.
I
Anyway, guys.
Yeah, you had an aneurysm?
we have a defibrillator here somewhere.
Just checking.
Okay, go ahead.
So, guys, I'm sure you'll join me in welcoming our viewers
Hey,
and
guys.
listeners. Thanking them for their ongoing support. Much appreciated. And we're still looking for likes. So if you enjoy what we're doing, please let us know. If you don't enjoy what we're doing, also let us know. And we'll try and
No, we won't do a damn thing.
convert you into believers. And last but not least, we're looking for subscribers.
There you
Be
go.
so kind as to subscribe. Just click on the button.
Cha-ching.
Don't wait. Do it now. We appreciate it.
Excellent.
You have nothing to lose and everything to gain.
With that out of the way, let's dive into today's topic.
What are we talking about, guys?
We're talking about healthcare, and more specifically, whether or not we believe that healthcare should be provided as a universal service to society, or whether it should be a paid-for service by members of society,
Or somewhere in between,
or somewhere in
perhaps.
between. Sure, wherever your opinions take us.
Beautiful.
And Dominic, being that I think I have some suspicion that you have, some opinions on this topic. Why don't you get us started?
Sure. I think universality of healthcare is the humane thing to do. But,
There's the but.
there's the but,
I almost had a heart attack.
Dominic used the expression humane.
humane. But we know for a fact now, it doesn't work.
And,
doesn't
and how do we
work.
know that?
Well, we know because hospitals, ERs are overwhelmed. You can't get the services. A lot of people don't have doctors. It doesn't work. However, it should be universal, but it doesn't work.
So you say it doesn't work. Is it fair to say it doesn't work, or it doesn't work as effectively as it should?
Okay. Yeah. Doesn't work as effectively as it should.
Okay.
Some things do work, but it's getting worse and worse every day. And why? And we throw a lot of money to it. And it still gets worse and worse every day. So we need to revisit the way we do this. Maybe to the idea of a NORAN, somewhere in between. But, universality doesn't work anymore.
All right. Naren, your thoughts?
Well, I'm kind of with Dominic on this one. With respect to how we can make it work, I think the management of the system leaves a lot to be desired. I think the efficiency of government has a lot to be desired, as we spoke about a long time ago on this podcast. And because the efficiency of government isn't where it needs to be, and because we haven't figured out a way after all these years, we've been doing this now, 50, 60, 70 years now in Canada, at least.
Early 60s, yeah.
There we go. So 60 plus years. We're still not in a place where we can say that our metrics are getting better, that our ERs are getting better, that people have family doctors, and we're constantly at a deficit when it comes to healthcare. Now, we do have a somewhat of a budding private practice here in Canada as well. And
In parts of Canada.
in parts of Canada. In my opinion, I think it's a hybrid model similar to what I think is happening in the UK, which makes the most sense, whereby people who can afford to have private health insurance or private procedures done take some of the strain off of the public system and allow the public system to become a little bit less packed, if it were, as it were, with people, and potentially work a little bit better. So I think, definitely a hybrid system, in my view, works the best.
Although it's not quite that simple, and we'll come back.
Exactly.
We'll come back to
Nothing is
that.
simple when it comes to healthcare.
No, of course.
So we do see examples of it working, but it's not absolutely universally free. And the examples I'm thinking of is in Western Europe. In places like Switzerland, in places like Germany, it is largely a universal system. There's a copay formula that's in place, but they also have the teams, the doctors, they have the resources, the physical resources, the hospitals. Their reality, they have succeeded in advancing us significantly when I'm talking about our Canadian example. In Europe, I know Europeans who have come to Canada that we have this conversation. They're shocked by our healthcare, the state of our healthcare system, when you have to wait, 24 hours for a doctor to see you in an ER in Canada. That doesn't exist anywhere in Western Europe, as far as I know, and that they have a universal system. So that we have, I don't understand why we're so far behind. I don't understand why we're not learning these lessons that the Europeans are showing us. The other reality is, as a society, what do we do about our healthcare? And I don't think we're very good about taking care of ourselves. And as we know, obesity is rampant in our society. And at some point, you can have the best system with all the doctors and all the resources and all the tools in the world. But if you are a population that's absolutely hell-bent on not taking care of yourself and being obese and having these very significant health problems, no system will be able to deal with that at that level.
So you're blaming the users.
Well, as a society, of course, we have healthcare is a personal responsibility, and of course, we have a role to play in this.
Okay.
So I don't want to take away from the earlier question, which really is at its root whether or not we believe that a baseline of universal health care is an entitlement or should be an entitlement in society.
Absolutely.
And so there, I think I hear everyone saying, yes, it should be.
I agree.
I agree, because we can talk about the U.S. model in a minute, and yeah, I definitely agree that there has to be some sort of universality.
Universality.
Thank you. For healthcare, it is a human right.
Okay, fair enough.
Yeah.
So on that point, there's agreement, at least amongst the four of us.
Yeah.
But we seem to differ on other viewpoints. Aki, you're introducing this whole idea of the user's responsibility to keep as well or as fit as possible in order to ensure that we're not taxing the system unjustly.
And not only, no, I wouldn't even put it that way. Just common sense. Take care of yourselves, right? I mean, we all want to have a full, productive life. Who wants to be sick in life? So let's do that.
So that's a responsible viewpoint. I don't think everyone thinks that way.
Yeah, exactly.
And so one of the questions I have for you and for the rest of the group is whether in a country that provides universal health care, should individuals who don't take care of themselves be provided with the same services at the same cost as individuals who are much more responsible about their own well?
Well, the easy answer to that is no, but you can't do that.
How do you manage that?
Yeah,
Yeah,
you just can't.
And there's something called the Hippocratic Oath. I mean, as a doctor or as a medical professional, you cannot turn anybody away.
No, he's not talking about turning people away. He's talking about the cost.
Right.
So do you charge someone more who's obese, who needs to have diabetes?
You can't go down that path.
Well, exactly.
It's tough.
And I agree with that. I think it's, hypothetically speaking, it's an interesting thing to discuss, but I think the implementation of such a service that's based on previous health and the choices that you make is almost impossible.
Okay, so if we believe that it's almost impossible, then I want
However-
to go back to Aki's earlier point and say, if there are no consequences,
Well, there are.
then why should people care?
No, there are consequences. It's like, for example, if you need another kidney, or if you need another lung, or if you need some sort of transplant, they take into consideration. They're not going to give you a new liver if you're still drinking, for example. So, depending on the procedure, they do take into consideration the individual and the habits of the individual. It's not for everything, but for certain things,
That's fair.
There's a prioritization.
However, before we get to organ replacement, there are probably many, many, many years of healthcare, prescription medication, and a slew of other things
and
that all taxpayers in a universal system
Have to
are
support.
contributing towards and supporting.
Yep.
And disproportionately for individuals who choose not to take
but
reasonable care of themselves.
See, we're going directly to the outliers all the time, right? I mean, we can.
Well, I don't know about outliers in this case. Would we say today that the vast majority of the members of our society take good care of themselves?
I would say that
Eat
the vast,
responsibly, exercise.
So I think it's an age-related thing as well, right? The vast majority of younger people now are into healthcare or into a healthy lifestyle. They're eating better. They're drinking a lot of water. I mean, there's all sorts of these new health kicks that they're on.
Not seeing it.
Not everyone.
We're not seeing the statistics.
Well, guys, I mean, at a certain point, when you get older, you get sicker. You get.
Or no, I'm not disagreeing with the age comment. I'm disagreeing, and I unfortunately don't have the data to back up my position, that young people today are taking better care of themselves.
Better than the older people in society is the way I would look at it. So
Better
I
than
think there's
the
an
older
age
people did at their age, or better than older people
are today. Yeah, just from a. I mean,
No, I don't.
age
think
is an indication of usage of healthcare. The older you are, the more likely you are to need a healthcare
but the decision,
intervention.
but the lifestyle decisions you make at an earlier age are going to impact
Yes,
the degree to which you tax the health
but do you
system.
want the government to tell you how to live your life?
No, I certainly don't.
Well, then how do you get to that point?
Education.
So
But I see nothing wrong
okay,
while respecting people's individual rights, saying that we provide, as a government, we provide our citizens a baseline of care that you should all consider to be an entitlement. Beyond that, there may be fees associated with some of the health care you receive, depending on some of the life choices that you make. So, for instance,
no, you can't do that.
That's easier said than done.
Yeah, you can't do
But
that.
that's what they do in Western Europe.
so if I
How
choose,
so?
if I choose to smoke throughout my life,
Yes.
and we know statistically that at some point there's a high likelihood, it's not a guarantee, but a very high likelihood that I'm going to suffer from respiratory illness, cancer, and so on and so forth. The statistics are there today to back it up. Why should I get all of the treatments and impose a tax on the, and I mean a tax, I'm taxing the system, the healthcare system, to a far greater extent than someone who has not.
The example. Go ahead.
Yeah, you know why? Because most people in those conditions are poor people, for the most part. They won't be able to afford it.
Yeah, and the second part is you've chosen the easiest example to choose, which is
Well,
smoking,
it's an
which
example.
has the highest correlation of action to reaction.
But it's an example.
from a healthcare perspective.
But if we look at
if you
what
take
are the
smoking
areas-
aside, what would be your next example? And it'll be hard to find, I think.
well, it could be alcohol consumption or drug consumption.
Okay.
Yeah.
And those can be tested through blood analysis and various other.
We have to make it. I think we have to make it.
fair enough.
We have to make it a national priority. I mean, how much? Look at right now. If we look at again the Canadian example, and we look at our particular example where we are, how much physical education is there in the schools? When I think all of us, we had some significant physical education
Yeah,
programming.
because
in
there
our
was no
schools.
internet, there was no Game Boys. There was
No, but I mean, even at the school, I mean, to young people, kids, to be able to introduce them to good, health, healthy living.
Well, they're not
habits.
allowed to compete anymore. You can't play dodgeball because, oh my God, someone might lose.
Right.
Someone may get a ball in the face.
Well,
I'd like to address 2 points were made here. First, Anki, you said in Western Europe, it works better than universal health care. That's because they take so much less prescription drugs than North America.
Maybe.
Like I've been in biotech for a couple of decades, and the sales there compared to North America are a fraction, maybe 40% of what they are here.
yeah.
Your point about private sector, you said that it makes it easier on the public sector. But the only problem is that it takes away resources
That too,
from
yeah.
the public sector
Right.
to go into private. So it doesn't, so it accentuates the problems in a way. It does solve some issues, but not all of them. So that's the 2 points.
Yeah. There's no one size
No.
fits all,
No.
right? I mean, it's a matter of finding the right balance for the society, and all of these things are going to help.
Yeah.
Well, I'll tell you what's not helpful. So there are certain countries where there seems to be increased pressure to provide a broader variety of health-related services to citizens before having addressed
Yes.
some of the issues that are severely impacting the system as it exists today. So instead of having this approach of let's improve what we have, and once we've done it
Expand
to a
our
degree
services,
that we feel confident that we can maintain or gradually improve the quality of services, then we can introduce some additional services. But that's not what's happening. What's happening is we're introducing more services. And the effect is that, for one thing, we're not providing much needed attention to existing areas of service.
So, what are some of the examples of the services that you're talking about?
Pharmacare.
dental
Okay.
as one example.
Right.
So in Canada, I'll use Canada as an example.
in vitro fertilization, I think, was another one for a while.
In that is occurring, I would say, on a province by province basis, to varying degrees. But there are some that, under the umbrella of medical services that the government is essentially enforcing through the provincial delivery systems. That the most recent example would be dental.
Yeah, but I wouldn't lump dental into a healthcare conversation. Dental, in any case, for the most part, is private. It's not a public system. I mean, there are some programs.
It is today, but I think what we're seeing is the tip of the iceberg.
Right.
It's
Right.
a change in philosophy that leads to actions that are intended to provide a growing number of health-related services.
Right. But one argument would be that by dealing with a lot of oral hygiene issues, you're preventing other more serious health issues down the road. So there's that as well.
I'd like to bring an aspect maybe we didn't think about, but we spend a lot of money taking care of very sick old people for a long time.
Mm-hmm.
What about, legalizing medically assisted dying?
Well, that has been done
What's
in
been
a
done?
number of jurisdictions.
Well, yeah, but not
And it's exploded, I think, in terms
but
of takers.
not something you can decide when you're younger. You've got all your marbles and say, okay, when I get to this level, pull the plug. And this, I think, would go a long way, saving a lot of money and putting it to the right areas.
So two points. One is that service, if we can call it that, is increasingly being provided, and certainly if we stick to the Canadian example, is now an option in many jurisdictions for elderly people who feel that their quality of life has suffered to such a point that they no longer want to be of this world. That's one. However, your point about that decision being made at a younger age, when you have all your marbles, I think was the expression, is that until you find yourself or you face the prospect of having to bring your life to an end, I'm not sure how you react. So it's one thing to say hypothetically, if ever I'm in a position where I can no longer enjoy a certain quality of life, I don't want to be here, pull the plug. And I've personally witnessed through family members, individuals getting to that point and saying, well, I'm not thrilled with my quality of life, but I'm not ready to go just yet.
That's fine.
But if you had asked them the question 20 years prior, they would have said, no, if ever I get to this state,
But,
pull the plug.
To me, a state would be somewhere where you don't know where you are, who you are.
I don't want the state to have that kind of power.
It's not the state. You have that kind of power.
Well, we do have that. I mean, we do have that
we
in our
have-
No,
system.
we don't. No, we don't. No. Because
If you haven't made your intentions known. But I will
No,
tell
yeah,
you,
yeah,
but I will
yeah.
tell you that today, if you're hospitalized, again, in certain jurisdictions, if you're hospitalized with a certain condition and you're of a certain age, they will ask you,
Right.
DNR.
before we perform this procedure, before we take these actions, what is your wish?
Well, it's only in terms of DNR. You cannot make any other decision, not yet, legally.
So do not resuscitate.
They're not
Exactly.
resuscitated. Yeah.
But that's not what I'm
But
talking about.
I mean, I wouldn't want to go any further than that. I think that would be as far as I would go.
No, that's not far enough. We've got hospitals or centers full of old people.
I know, but we have to be. I know, but the
But
issue,
you should at least be satisfied with the fact that legislation has passed, which allows people of able mind to make the decision.
I don't think so.
Oh, yeah,
of
you
course.
can.
Yeah,
You can. MAID is here. I mean,
medically assisted.
aid and medical assisted.
So I have a 90,
Assistance
soon to be
in dying.
95-year-old mother.
Yeah.
If she were to decide tomorrow, and she's of able mind, if she were to decide tomorrow that her wish is to pass via assisted suicide, for lack of a better term, then that option is available to her.
Yeah, it is. But there's standards. I mean, there's tests.
Yeah, no,
There's standards that have to be
I
met.
think you should be able to do that. Even
But
before.
I don't think I'm not comfortable.
You can put that in a will.
pointing.
No, you can't.
You can
it's
put it-
only do not resuscitate that you can put in a will.
Well, in a will, you're gone.
In a living will, I think they call
Yeah,
it,
living-
right?
I'm not comfortable singling out seniors in that way. I can understand where you're coming from, but there's so many other things that we should be doing, that we should be looking at solutions.
That's part of the solution. Or
It's-
it's part of the things to be looked
how about
in terms of cost savings.
Well, how about going back to what I said? If you're able to, if you take responsibility for your well-being and you have good, healthy living habits throughout most
that's-
of your life,
like I said, it's part of
number
the solution.
one,
Yeah.
and number two as well. I mean, for us, our seniors, and I think that's something for another conversation. But I don't think that our seniors are given a fair shake in our society.
What does that mean?
In terms of respecting them, in terms of taking care of them the way we should. I don't think we're doing a very good job of that in most Western world societies. So seniors, to jump right ahead and say, okay, well, now we have to do something about these old, infirm people that are taking up too many hospital resources. That's a leap. That's a leap, considering how we're not doing very much, to handle this population better, support them better, and respect them more.
Okay.
I don't think that the two points are mutually exclusive. So while you may be perfectly right in what you're stating, today, again, in certain jurisdictions, nothing prevents an elderly person, not someone else to make the decision on their behalf, but an able-minded elderly person to say, I would appreciate assistance in ending my life and bringing my life to an end,
But
because
we
I
have
know
that.
because I no longer have the quality of life.
I can see the place of that, but I'm just saying for me there's a bigger question that we should be
We have to look at
putting
all of
out
it.
there.
And that's part of it. I mean, the other part of it is how many people go to the emergency room with a scratch on them.
Exactly.
Right? I mean,
Well-
there's a certain amount of self-inflicted
That's entitlement.
pain
Yeah.
that we've given ourselves. And the flip side of that is no one has a personal doctor or someone they can go to or call for things that they should be able to do.
So there's two things that I want to say. Number one is we've been so slow, like a snail's pace, to reform our the medical profession.
Yeah.
Right. So for example, nursing and nurses.
Yeah.
Now we're giving more authority to nurses, and we're giving them a
Finally,
greater
yes.
responsibility. Finally. This should have been done 25 years ago,
Yeah, it's 'cause
generation
there's-
ago.
It's because there's more male nurses, so finally we're giving them more.
Right. And how about some
responsibility.
alternatives, to the ERs? And I'm talking about like alternative clinics that can deal with some of these, the kind of example that you gave, the lighter cases. Don't have to wind up in the ER. There's an alternative, clinics in the community where they can go to that operate around the clock. We should have done that a generation ago as well.
Yeah.
What about implementing? I'll call it you can look at it as either a reward system or a penalty system for what I consider good behavior. What is good behavior?
Yeah.
If you're an adult and you are diligent about seeing a GP once a year for a thorough assessment of your health, and you are contributing to the healthcare pool through taxation and so on at a certain rate, and someone who ignores health professionals and essentially sees them at best on an as-needed basis.
You can't do that when no one has a doctor.
Okay, I'm not looking to the reasons why you can't today. I'm bringing an idea forward saying, should you be rewarding the person who's diligent by saying you get tax relief, and or penalizing the person who could care less and is not taking the necessary steps to ensure that their health is being assessed on an ongoing basis?
I see where you're going with this, and I can understand, and I can even support the logic. I'm not sure how it would be implemented.
Yeah, how do you implement
Not
that with
complicated.
40 million people in a country this size, much bigger in other places, and trying to follow everyone's life and the decisions they make? So you're trying to micromanage everyone's life.
It's all
for a
computerized
reward?
today. It's all computerized. The
Well,
information is there.
It's your visits to the doctor.
It's there. Your results
They
are.
still use fax machines, for God's sake. You think everything is...
You're looking at the system as it exists today. We're trying to bring new ideas to the table that are going to improve the system, and there's no shortage of things that we can do to improve the system.
Okay, but
So basic things. You talk about nursing and recognizing a nurse's ability to make certain decisions that previously required, an MD to sign off on. Okay, what about recognizing individuals who come to a country with nursing degrees from other countries
Oh, yeah.
that we choose not to recognize? Caregivers who are as able, as competent as the ones we have formed ourselves here, and yet we refuse to recognize their credentials.
Yeah, but
We won't give them an equivalency test or assess their capabilities.
They drive
we simply
cabs.
say, no, you have to go back to school for 3 years, 3 years, before you are given the right to practice your profession.
That's a shame. Exactly. And
Well, you're going to have some standards, but
Yeah,
but let him pass the test.
Who says there's no
Yeah.
standards? Maybe the standards from elsewhere are as high or
Yeah,
higher
I
than the
agree.
standards here.
yeah.
That's a big problem.
But often
Assess competency.
it's not. But
and
there's,
language skills.
there's another element.
Well, that's true of one jurisdiction in all of North America.
There's one element that is
Don't get me
taxing
started.
the healthcare system is mental illness.
Yeah, that's the other one.
That's huge. We've got all these ERs, all these people with mental issues coming in, and
It's part of the
But
homelessness issue
that's
as well.
taxing one area of healthcare.
taxing.
And it's growing. That's a growing
Yeah,
area. Of
exactly.
I'm not
healthcare as
disagreeing
well,
that, but I'm saying it's one area. It's a specialization within healthcare.
Yeah.
Yeah.
So, guys, there's no easy fix to this.
But I want to go. I want to go. Sorry.
Go ahead.
I want to go back to it. So I'm on the same page as you. I'm just saying, like in terms of, so even with computers, even with technology. So those of us, who are seeing our doctor regularly, assuming we reach a point where everybody has access to a doctor, which is a big if. But if we reach that point and we are using those services, we're taking good care of ourselves. We're seeing our doctor. So when it comes to, how do I get recognized for being a responsible, taking care of my health? I'm behaving responsibly. How would I be recognized in order to benefit from what you're saying?
How would you implement
Well,
it?
all
other
the
words?
information is computerized, so you'd have a
So who would have
central
access?
repository of information that is accessible. Well, in the same way as
guess
if you,
It's not manageable, in my opinion.
Well,
that's like I refuse to accept that. That's like telling me that my employer cannot send a tax form to the tax authorities
but
in order
Pat-
to ensure that when I file my taxes, they can reconcile the data that I'm providing and that the employer is providing.
He goes to a doctor once or twice a year, no problem. He smokes like an animal and he drinks like a fish. Where's that written down? So do you reward him now or do you take points back? How many points do you give him?
Yeah.
How many points do you take away? He
Well,
likes
let's
to drive
do-
recklessly.
No, fair enough.
He rides on a motorcycle
Without a helmet.
Without whatever. He likes
Well,
to raw
no.
dog it
So-
all the
so
time, so he
they-
might catch an STD at
They're-
any point.
You're mixing in some legal issues
okay.
with other
But
issues.
let's go back to
So
the,
let's not make it more complicated than
let's
it
go
needs
back to
be.
the basic theory.
So to your point, I would say there are a number of factors that can be taken into consideration and use a weighted scorecard approach to say.
To each individual, 40 million people are going to have a scorecard.
Well, first of all, it's not 40 million.
Okay, 20 million people
Okay.
are going to have a scorecard.
Yeah, why not?
Okay, well,
Are there 20 million people filing taxes?
yeah, okay.
There's two issues with this, Pat. One is again it's
Can't agree with
privacy concerns. Number one,
Privacy.
Well, yeah, I mean,
Do you realize that every health in Canada today, every time you're subjected to imaging, blood test, and a slew of other medical tests, that information, the results of those tests are published online in government repositories. Do you know that?
Yeah, and you
I
can access
don't know
them.
enough about it.
You can
You
access,
can access them, exactly.
Other people can access them. So when you
Other
talk
people
about
are not
privacy,
supposed to access them.
Well, yes, your doctor is supposed to
Other
access them.
individuals are not supposed to access them. Healthcare providers.
so
That's also true of your taxes. All your tax information is posted online. Other people are not supposed to access it.
yeah, but Pat, okay. So,
At what point do you
then-
say, well,
Listen,
I'm so concerned with privacy
Okay,
that...
to me, rather than focusing on trying to figure out how to reward people who are better or worse, I think we should be looking at a macro situation, which is the way the system is put together in the first place. And I think it makes more sense. Although what you're saying could potentially have value, it's just not implementable.
All I'm doing is making suggestions, tabling ideas
Right.
that are aimed at ultimately changing behaviors. Because if we believe that changing behaviors
Yeah, he talked about
is
education.
an essential component
Yes.
of getting ourselves of the existing healthcare mess,
Yeah.
then I'm going to suggest that talking about it is insufficient.
I agree. I agree.
So
Simply, simply relying on education is going to be insufficient.
Well-
we've educated people now through a number of different means for decades about the perils of smoking. Yet people continue to smoke in large
Yeah,
numbers.
but a lot less people smoke.
But a lot of people still smoke. So for those people who choose to continue smoking and who are going to put a greater burden on our healthcare system, why should they get the same free ride everybody else does?
And the other issue in all this is that the medical profession. Doctors are already screaming about how much administration they have to do, how much paperwork they have to do. So if you want them to be part of this, some sort of tracking system in order to be able to
modernize.
Okay, so guys, why don't we just take it up a notch or two in terms of macro level and start looking at things that are a little bit larger in scope, such as the way the hospitals are structured, the management schemes that are put in place by governments, the way that doctors from other countries that come in here and nurses that come in here can get certification on an accelerated path, the way we can
take charge of our own well-being and our health.
Just all of the other things. I mean, what you're saying is one aspect of it, and we spent we talked about it a lot. But there's so many other things that we can do from a macro level that can incrementally improve the services that are offered to us. And it seems somehow, and I don't know why our governments aren't doing this, or they're trying. Every few years, they try and change a few things. They retinker with things. They come up with a new reform that's supposed to fix
governments,
things.
all they're doing is creating new bureaucracies. There's very little innovation and new thinking in this.
So what are the things that we can do that can actually help?
You have to bring efficiency into the system, and we've discussed previously, episode 2, for those who are wondering, that government is inherently inefficient.
Okay.
And so
how about the private sector?
You need to introduce. Well, you say private sector. If any one of us has had the opportunity to access private healthcare,
yes,
here or elsewhere, it's completely different than the public system.
Yeah, much quicker.
So if you have an appointment, much to your surprise, you will find that your doctor is likely to be on time.
Yeah.
There's a lot less waste. There seems to be that there's accountability. Whatever facility you go to, someone is ultimately accountable and or responsible.
Yeah.
Right. And so stuff gets done.
Okay.
And it gets done. And not that there isn't room for improvement, because there's always room for improvement, but it is 180 degrees removed from what most people experience in the public system.
Yeah,
So the U.S. system is the right way to go then?
No.
No, exactly. Because
Okay, so why?
Because the U.S. doesn't really provide universal health care.
Okay, so
that's, in my view, with all due respect, a fundamental flaw in the U.S. system.
okay, so there aren't.
But the fact that it's that the private sector can efficiently manage large, complex health systems tells us that it can be done.
yes, it can be.
And we need to bring the discipline, the processes, procedures, know-how, competencies
okay,
into our existing system
so let me-
if there's any hope of
So
improvement.
let
let
me,
me. Okay, go ahead. You go.
so let me provide a solution or an idea. A lot of doctors are opting out of the public to go to private. Can I, Dominic, opt out the public, go to private? Which means government reimburses me all I've paid into the universal health care, and then I go private.
The government can.
I don't think government will do that.
They can't.
Of course not.
But I will say I have no problem with the government continuing to ask me to contribute to the public system
And paying the amount that they would
while
pay.
giving me the option of using the private healthcare system at my choosing for a fee.
Correct.
So you're
And
financing-
As opposed to telling me you do not have the option of pursuing a private.
That I do agree.
And by the way, they can pay the private doctor the amount they would have paid the public doctor, and you pay the difference, is I think what you're getting at as well, which is a way to do that.
I haven't gone into the economics of it, so I don't know. What I'm saying is philosophically,
Right.
I do not have an issue with continuing to pay my fair share
but if
into the public bucket.
if the public bucket, if the public service, if you go private and you then get a bill for the doctor for $100 for that procedure, and in the public system the doctor would only have gotten paid $50, then you would expect the public system to pay the doctor $50, and then you pay the $50 extra because you've paid into the public system and you've gone out of the public system to go to the private guy. And economically would be equivalent to the government.
I hear what you're saying, and I'm not saying it's a bad idea.
Well,
all I can tell you is I don't even have that expectation.
No, but I'm just trying to throw
in
some
your
ideas out that
Fair
would,
enough,
that would,
but in your example,
Yeah.
I'm okay paying the $100.
Okay, well, that's fine. That's fully private for you and for others that do that. And we have that available to us here in certain places and certain jurisdictions.
Right.
So we have that. But to Dominic's point, that also robs the public sector of resources because the doctors that opt out of there will mean fewer doctors. So if we can fix the doctor...
Yes and no. Yes and no, because you say it robs the public sector of resources. On the one hand, it's true.
On the other, it's not.
But on the other hand, I'm contributing, as I always have, to the public system.
And in theory, you're reducing
But
the
I'm
workload in the
but
public
I'm
system.
not putting the same burden on that system, which means that they should technically have more financial resources available to invest.
for less
Yeah,
people.
but the reason why-
But there's also, there's one other thing is that a lot of doctors aren't allowed to go past certain number of hours in the public ORs,
Exactly.
and they can now use those hours to go private. And in that case, you're not really taking anything away from the public system.
Well,
so you're not.
You're right. But the reason why a lot of doctors are up to get of the public system is because they're only allowed to be 15 minutes, in our case, with each patient.
Yeah.
And to them, that is ridiculous.
Yeah.
But this
So-
speaks to the inefficiencies of the public system and decisions that are being made by officials that don't necessarily have the necessary knowledge or skills to bring good solutions to the problem we face or the problems we face in healthcare. And so they're going at it, and again, with little exaggeration, willy-nilly. Let's impose time limits, and by imposing time limits, that means that the average doctor will get to see that many more patients
Right.
over the period of an hour, and so on and so forth. So that is such simplistic thinking,
Exactly.
and we have government officials. That's the best they can do. That just tells you that they don't have the necessary knowledge and skills to deal with these issues. Let's bring the right people in.
By the way, you said something earlier that I had an issue with,
Mm-hmm.
which is you said the U.S. system or the U.S. System allowed companies or private sector to be able to manage large healthcare institutions in a proper way. And I'll kind of say one thing. The only reason I think that they're able to do that is the crazy amount of money they charge the people to access those services.
Yeah.
If they were now deprived of the thousands and thousands of dollars they're getting, more than the public system here in Canada, I think they would all crumble. So I don't think they may not be better run, but they are certainly better funded. And I think
Excellent point.
Well, I think they're better run. The funding part, I haven't studied enough. I haven't looked.
for
at
sure they're better funded.
I haven't looked at their financial statements to
But the markup.
assess.
Well, look at the markups.
How outrageous the profitability is that some of these organizations are generating. But somewhere between the U.S. system and the Canadian system, I believe, is a better solution for both.
100% agree with you.
And one that should be able to provide. It's not going to be perfect. It never will be.
No.
But a much more adequate level of care than is currently being provided, certainly across Canada and in the U.S. as well, but for different reasons.
Yeah, I agree with you on that 100%. And I think it all starts with the resources. And we should be focusing in as much as possible on increasing the number of resources that we have when it comes to doctors, nurses, orderlies, the whole gamut within the healthcare system.
Well, you're talking about
sector.
human resources.
Human resources, because
They're also material resources.
I think that's less of a problem in our situation right now. And I think one of the major things that stop us is, to your point earlier, about all the foreign workers that we have that have capabilities, and maybe they're 100% of the way there, maybe they're 80 or 70% of the way there, but don't make them go to school for 3 years to get the extra 5, 10, 20% knowledge. Get a 1 year brush up course or 6 month whatever. Have them shadow an existing nurse and have them have that nurse make an assessment that they can now say, okay, you passed or you didn't pass. Whatever. Let's find ways to make this thing work, as opposed to forcing people who've come from another jurisdiction who have great healthcare there to our jurisdiction and then penalizing them like we do now. We need people.
Yeah.
And the stupidity of government, it just blows me away.
So-
the arrogance.
Right. So one reality is that if you look at just purely at these statistics, that apparently, if we look at our situation in Canada, we have the right number of doctors per 100,000 population. If you look at
Yeah,
international,
they're all in the wrong places.
Sorry, who's made that assessment?
the international, I think OECD, any international medical, body, the United Nations.
So what's the issue then? The location?
Well, the issue is okay. So that's the reality. So the issue is that some doctors, which is perfectly understandable, are making life quality choices. So they're not working as many hours and taking on as many patients as their predecessors did, and they're also finally standing up and they're saying, the funding that we're getting from the government is ridiculous. We're not accepting it, so we're going to make adjustments from our end. So a lot of that is happening, which is I can understand that, and I can support them. But what we have to do is, yes, at the level that you're talking about, Pat, but prevention, again, I go back to prevention. We have to be big on prevention. We have to be big on support, for caregivers, especially caregivers for seniors, who are taking care of the elderly, in their homes. Build on that, encourage that.
It's usually
support
family
them.
as well.
Exactly. Support them. Absolutely what you're saying. We know the number of residencies that we're giving out completely inadequate. The delays and the demands that we're putting on foreign trained health professionals, we're really backwards, on that score. And a cultural shift, just a cultural shift in terms of, taking care of ourselves, being healthy as individuals.
About heavily taxing unhealthy products.
We were doing that. Alcohol, tobacco, we're taxing them
go
into the
further.
universe.
Coca-Cola, all this stuff.
Chips.
Candies.
Well, I remember when I was working for the city of Montreal, we had a bylaw that we had debated and was passed, limiting the number of fast food establishments in the borough for the reasons that you're citing, Dominic. And it was
How did that go?
very controversial, very, very controversial.
I mean, fundamentally, I think we have to achieve the right balance in society. So I would say where young children are concerned, absolutely. So don't allow vending machines in schools, for instance, where kids can get, pop at their heart's content and foods that are terrible for them.
Red Bull.
But for an adult, for government to tell an adult, you should or should not be consuming these products, if it's for health considerations, make a suggestion, offer a suggestion, but you can't mandate it. And then you want to start taxing it. To what extent? So we see it, for instance, on tobacco products. They're heavily taxed today. Alcohol, well, it's a double-edged sword because the government relies on alcohol to generate revenues. So they're happy to sell alcohol.
In Canada, yeah.
Well, in parts of Canada, for sure. It's controlled to varying degrees. And so it becomes a significant source of revenue for them. So there's all the hypocrisy that goes with that.
Yeah, and in a perfect world, I would also add, again, going back to doctors, those who choose to stay in the public system, I'd pay them a premium. I'd make sure that they're really, really well paid. I mean, there's certain standards that we'd have to put in place, but I would pay them a premium.
Out of existing tax dollars, or are you prepared to increase tax?
Sometimes I'm prepared to live with a level of debt.
Okay,
I'm not.
I said it. It's not just money that makes them go to
No,
the
it's
private.
quality of life.
Well, it's quality. Also, you can't spend 15 minutes with a patient.
The demands are unreasonable beyond.
Right. So you have to reform that.
They're
All
feeling
that has
that they're
to
not
change.
being compensated.
Exactly.
All that has to change.
Plus all
that
the
has to change.
paperwork, as we said
Look,
earlier.
an oncologist versus a family doctor is not the same length
Yeah.
of time.
Yeah, that should be up to the doctor.
Yeah.
The doctor should decide how much time they're spending with the patient, and just here's the invoice, and
And there's another
you
issue.
just take care of it.
There's more and more women doctors. They have more responsibilities at home.
Yeah,
So they work less.
yeah.
They see less patients.
Yeah.
So there's that phenomenon.
But you're right, Dominic. I think the real core issue for the public system is the workloads and the quality of life, and a lot of professionals are walking away from it because it's just not worth it.
The scary thing is that when they go to private, they don't have the same number of patients.
Of course,
So
but private is also cherry picking. That's the easy thing to do.
In what sense?
You select your patients. You don't you select
yes,
your
not really.
not
The
really.
patients
Patients that pay are the ones you get.
Not really.
You don't select them.
If you're going to pay,
They
you're going to
select
pay.
you.
Yeah, well, you should first of all, I know for a fact that doctors who go public, they have a very limited number of patients. They're not seeing the same number of patients that they were seeing before when they
Doctors
were
who go private.
private,
Private.
not seeing the same number of patients they were seeing when they
course.
were in the public system. There's a drastic change there.
Yeah, but if they had enough demand, then they would potentially see as much. I mean, it's just a matter of supply and demand and the choice of the doctor as well. The doctor will probably be able to see a lot less patients and still make more money
I don't
than
think,
in the public system.
I don't think most doctors are in it strictly for the money.
No,
I
there
think
are
most
some.
doctors are spending more time with patients
Yeah.
because they believe
Yeah.
that that's the level of service that patient requires, as opposed to looking at their watch and saying, you know what, I'm sorry, but we're going to have to cut this short. I only give it
That's
15
true.
minutes.
That's true. But they're not charging. They're also charging private sector fees. They're upping their fees. So,
But they're not charging by the hour or by the minute. It's a visit. So if the doctor assesses that this visit only requires half an hour of my time and another visit requires an hour of my time, I'm not paying by the hour. My appointment is X $100 and that's it.
Yeah,
If I want to sit and talk about a whole bunch of stuff that's been ailing me for the past 6 months or the past year, the doctor is having that conversation without feeling the pressures of time. If, on the other hand, I come in 1 year and I say, I feel fantastic, let's just have the test and make sure, you have anything at all? Or, no, nothing. I feel fantastic. I haven't felt this good in 30 years. Great. Let's do the tests and we'll review the results in a week's time.
yeah.
That's how it works.
And the other very big concern is that we know that in terms of family doctors, there's far fewer doctors want to be family doctors.
yeah,
now.
they don't make as much money. That's why.
And that's where the big gap is.
And they've got a lot more paperwork to do than most others, a lot of others as well, right? So it's a double-edged sword. I mean, I remember 20, 30 years ago, I mean, doctors are making a lot more money now, thank God, than they were 20, 30 years ago here in Canada anyway. Because I remember at a certain point, I was looking at, doctor salaries and stuff like that and comparing them to mine as a sales guy in a tech company and thinking, oh my God, this is crazy. Why am I making more than a doctor? I don't have the education. I don't have the skill
Sobering,
set.
isn't it?
And at the time I thought, oh my God, this is ridiculous. And this is like, I'd say about 25, 30 years ago. And it wasn't like I was making a crazy amount of money, for the business I was in, but it's just doctors were so underpaid.
Yeah.
And it's gotten so much better now, but it's still not where it needs to be. I mean, these folks, the amount of education they have to go through, the amount of work they have to go through to get to the point where they can actually figure out what the human body is doing. And then, to be treated with such disrespect by the government, told where to go, how many patients to take, all this stuff. It's like, come on, guys.
Yeah.
You don't have to put them on a pedestal, but at the same time, treat them like human beings. And I think that would help, I would hope.
Yeah, I think, look, one of the, I don't know if distraction is the right word, but one of the realities that gets in the middle of what you're describing is the fact that as the closest neighbor to the U.S., a realization of what a doctor of equivalent experience and expertise can earn in the U.S., as opposed to looking at, you use the example of Western Europe. And so is it that doctors in Canada are so poorly paid, or is it in relation to what they could earn in the U.S.?
Well, it's both, but it was a lot worse 20, 30 years ago with respect to other sectors of employment. At this point in Canada, doctors make good money compared to other sectors
they're fairly
in
paid.
Canada. They're fairly well paid. A sales guy working like I was doing now will be making half of what a doctor makes, as opposed to more than a doctor.
Okay, but you can always take examples of different walks of life. You have real estate agents today who are earning 7 figures. That's more than a doctor will earn in Canada. Is that deserved, or should a
No,
real
but
estate?
that's exceptional, is what I would say, right?
Coming out of COVID, it wasn't that exceptional.
The typical. I'm just saying they're doing a
Well,
lot
the
better.
the
than
average
they used to do.
salesperson doesn't earn what a doctor earns either.
They were 20 years, 25, 30 years ago.
I'm not so sure. In certain fields, perhaps.
In tech, it was
Well,
different.
but tech was on the rise, and there are explanations for that as well. So, look, we use the example of professional athletes,
exactly.
real estate agents. So, are doctors fairly compensated?
Well, I'm just saying they're
It's
better
always-
off than they used to be. That's all.
They are, but in relation to what their U.S. counterparts earn, that will always be an issue.
100% correct. Yeah, and that's the part of the brain drain that happens in Canada as well, with nurses as well as doctors being lured into the U.S. with lower taxes, higher pay, U.S. dollars. It's like
So
Yeah, although I believe that part of the equation is also more favorable working conditions.
For sure.
yeah, all of it.
I think many doctors wouldn't put as much emphasis on remuneration, strictly speaking,
I agree.
if their working conditions across Canada were much better than they are today.
Absolutely.
So do we encourage the proliferation of the private healthcare?
I think it can go beyond where it is now, but it needs to be balanced to the point where we're not taking too many resources away from the public sector.
Because that side is not regulated, huh?
Well, again, it's a matter of balancing. If you can make the public sector more attractive, you will give them less reason to leave the public sector. So if we can make the working conditions better on in the public sector, if we can provide better or at least somewhat better remuneration and salaries to these folks, I think it'll go a long way to make that balance better.
Don't you think that ship has sailed?
No, I don't think so. I think I think there's always ways to improve things, and the bureaucracy is a big part of the issue. If we can manage, or if somehow governments can figure out how to manage bureaucracy better, which it will be challenging, we can get there. Or we can start looking at other countries like the UK, like Switzerland, like other countries in Western Europe, and start maybe emulating them a little bit more, as
study and apply best practices.
Exactly.
I think that the issue is, if we do not make significant progress in addressing what is ailing the public system in Canada, then the expansion of private healthcare is going to have a very detrimental impact on the public system.
And it'll happen for sure, because people will be fed up with the public system more and more.
And more and more, it'll be like a two-tiered system.
Well, it is.
It is in a way. It is, but it's going to become like a
even more so.
Full-blown two-tier system.
It'll be a whatever prophecy.
Self-fulfilling prophecy.
Thank you.
Yeah.
I can't.
So one last thought is as we look at or study best practices in Western Europe, I think the application of some Eastern ideologies should also be incorporated into what we import into our system.
Acupuncture?
Without looking at acupuncture specifically, I think there are a number of different areas that we could look at. It's a more holistic view of medicine, as opposed to have an ailment.
I was wondering where you were going.
You have an ailment, I'll prescribe a drug.
Right.
Gotcha.
And I also think very.
So the use of pharmaceuticals, I think, in North America is
absolutely. And Eastern cultures and Eastern, the Eastern world, much more advanced in proper aging and older people being in good health and doing a very good job of still being vibrant well into their years.
So they don't just warehouse their old.
No.
We should talk about that.
I don't know if it's still true today, but I was told a number of years ago that you can actually get a medical degree in Canada without ever having to take a single course on nutrition. Imagine.
Wow.
Yeah, that's shocking.
So again, don't know if it's still true today, but it was at one point.
They should eat Soylent Green.
And you know what, guys? This is, it's very appropriate that we should be addressing this, because I don't know about you, but this is very close to home, right? At this point in our lives, the retired folks that we are, I am petrified of our healthcare system. And that is such a ridiculous thing.
Easy, don't get sick.
Exactly. But even if you do it, like Ray, you will. This is where it also gets risky, because you're going to want to avoid going to the ER, and we know people who have done that.
So just one thought that I'll throw out there, because my dad had cancer many years ago and had to go through the system in 2014.
I'm glad you're bringing this up.
And it's really, really important to note, we've been talking about generally, general issues, but when it comes to anything that's life-threatening, that's acute,
immediate,
that needs immediate help, if you have a heart attack, if you have, some acute, failure of something, the system works, and it works
very well,
pretty damn well.
I agree.
For most
I agree.
life-threatening,
I'm so glad you said that, because we can all share stories of people who recently have been diagnosed.
Exactly. So
they're in the system, and exactly the care that you're describing. They come out and they said, I'm very happy with the type of care that I got.
We've been shitting on the system in general, and in general,
it
can use a lot of help and a lot of support, but fundamentally, when it comes to life-saving procedures, there's not an issue. Thank God that we have that, and we can trust the system that we have, the public system that we have, and I think that's the minimum that it needs to continue to provide to everyone for us to move forward. We just need to make the rest better.
So imagine.
But what you're saying, I don't think is as true today as it was 20 years ago or 30 years ago, and we can use the example of parents. I can use the example of myself, where I received very timely attention at a time in my life where, it wasn't certain I'd be here 4 months later. And so I experienced firsthand the best of what the system has to offer. But I also know in more recent years of people in similar circumstances who haven't been seen for prolonged periods of time. And that time could have made the difference between their surviving or not. And so I do believe that we're headed in the wrong direction,
Fair enough.
even with some of the most demanding cases. And the entire system needs to be revamped. The entire system.
I think it screams for some trailblazing leadership, and that's what we're sorely lacking. Because if what the people, and God bless, our healthcare professionals, what they do with what they have is phenomenal. And if we could just give them, the better strategies, the best practices, and just listen to them, and be able to take, the reform of the system to a higher level. Never mind the practices of the past, but really plan for a 21st century, healthcare system. If we can accomplish that, then I think we have a model that will be gold.
Yeah, so I think you may be overly ambitious. I'm not even thinking of trailblazing. I'm thinking of competency. Bring competent leadership in place, and you will see dramatic improvements. Once you've made those improvements, then you can look at blazing new trails.
Some Boeing executives available.
Yeah, the system would chew them up and spit them out in a hurry.
Exactly.
Yeah.
All right, boys. Any final thoughts?
Well, I think we've got a lot of work to do on this one. I don't think it's going to be an easy fix. But we got to start somewhere, and we better start it soon. So
Yeah.
Yeah, I think it's going to be hard to stop this private healthcare surge. It's going to get worse.
I think it's a very I think universal healthcare is a very laudable program, and it deserves to be saved, and it deserves to be preserved.
Yeah. So on that note, we should all think long and hard about the next governments that we want to elect, because this should be one of the most critical issues and top priorities for everyone.
Yep, especially retired guys.
Yeah, right. All right, guys. Good conversation. Enjoyed it once again. And
Thanks, guys.
Thanks for joining us. We'll look forward to seeing you all next week.
Thanks, guys.
Bye.